in every picture, you guys are like this.
Yeah.
Because if you see the X-ray with transnasal, the transnasal looks like a V, like a V. Dr. Vanderlim
Dr. Vanderlim with the V.
With the V, yeah, that's why this is the word.
So you guys, this is like when you guys took the picture, you guys were saying like you guys...
Vanderlim and transnasal.
Vanderlim and transnasal.
And transnasal, yes, for sure.
Wow,
yeah. We take a couple pictures of the surgery. Yeah. Probably is the next picture of the next book of Dr. Vanderlim. Probably. I don't know. Wow. Probably.
He was very excited. Hey, this looks like a picture of books. I want to take some pictures.
Wow. So can we say that if a patient comes in, there is no reason why a patient cannot have something permanent?
Right.
That is correct.
So I heard that Dr. Luis had some experiences. So, Dr. Luis.
The beach or where?
Crazy experience.
So both of you guys were with Dr. Vanderlim in the last surgery?
That was the last surgery.
He looks very
Friday in the
happy.
afternoon.
It was the last one of the course.
Yes, the last one of the course.
And both of you and Dr. Vanderlim were there, and you guys were able to perform everything.
Yes.
Yeah. He was very excited also.
He's very excited.
Wow. Yeah, we can do...
Take a picture,
we can play with all the procedures.
Would you guys like to go to another one?
For sure.
100%, yeah.
100%, yes.
Of course.
100%.
Of
It's
course.
because with Dr. Vanderlim, we have the opportunity to take the training with patients, real patients.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Spotify and we're on Apple Podcast. Follow us, listen to us, like us. Today we have Dr. Luis.
Hi.
And we have Dr. Alonso. How you guys doing? Welcome back.
Hi, guys.
Thank you so much. Thank you so much.
So we're here today because you guys have just recently came back from Brazil.
Yeah.
You could see the doctor has a tan. We could see Dr. Luis doesn't. But they were both in Brazil, I promise. And what were you guys doing in Brazil?
The main purpose was we did a residence for 5 days, 3 days in a hospital, and a couple days more learning about implants, more implants, zygomatic implants and transnasal implants, and a couple new techniques that we are trying to approach with the new patients.
Okay. And who was your guys' teacher?
It's Dr. Vanderlim. He's a top doctor. He's the expert with the technique. Well, he is the creator of the transnasal implant. Very, very good experience to learn about different techniques to offer more solutions. When, for example, when the regular bone is very, very thin or we have a lot of restrictions, we have the opportunity to put implants in another bone. For example, zygomatic bone or the nose is a special bone. It's the concha.
Yeah.
It is the concha.
The conch bone?
The conch bone,
Conch
yeah.
bone.
But
The
yeah,
muscle.
very, very good experience.
So Dr. Vanderlim is a doctor who focuses on using and utilizing the bone that's in you
Yeah.
instead of bringing bone grafting, correct?
Correct.
Right.
So you guys were over there. What did you guys learn? Well, I mean, obviously you guys were super excited. If I'm not mistaken, I remember you guys told me you guys wanted to go to some sort of training, but then you guys figured out that there was a residency
Yeah.
Right.
in Brazil, and you reached out and they told you there was only one opening.
Yes, only one. Yes.
And I told
One
you,
opening.
I told you, hey, well, let him know that he's your supreme brother. Let him know. Send him the picture when you guys were all in Mykonos.
Yes.
Because we'll post the pictures up, and George won't forget this time, George. And just by the way, George looks really good right now. He has his little sweater on. George, do you mind come over here real quick, man, so we can see you in the cameras?
Please.
Yeah, come on, man. Come over here real quick. Because George always wears just like, he's like half naked when he comes and records. But this time he's looking good. He has a little sweater going on.
Very good today.
He has that winter swag.
You're looking good. Yeah.
Look at that.
Okay.
Thanks.
I'm telling, wow. Look at this.
New haircut.
I like that. Haircut at the
Yeah.
Fade Zinc commercial to
Oh, yeah.
Manny's barbershop.
More handsome.
Okay. More handsome,
more
there you go.
handsome,
Nice.
yes.
About time.
About
time.
Junior.
About time, buddy. There you go. There you go. Well, you're looking
Good
good,
man.
man. We
Good boy.
appreciate you.
Thank you.
Very good boy.
But going back, and they told you that you sent the picture to Mykonos when it was you, Dr. Alonso, and Dr. Elias with Dr. Vanderlim,
Right.
and you told them, hey, we were in Mykonos, Greece with them. We really want to go and be able to do this, and they told you that they could do it, but it was only 2 doctors per patient. That means that you guys were gonna have to split up for 1 doctor.
Yep.
And that's the mentality that you guys said, okay.
Okay.
He was going to perfect his his pterygoids,
Pterygoids, yeah.
and you were going
Zygomatic.
to go for zygomatic implants.
Zygomatic implant, yeah.
Now tell me what happened when you guys got there. Tell me what happened when it was surgery. What happened? What did you guys do?
Well, basically, the course is with only 1 patient. 2 men and 1 patient.
2 doctors, 1 patient. Yeah.
Only 1 patient, 1 surgery is the program. But with Dr. Alonso, we have now the team is with 3 doctors, only 1 patient. Well, it's okay. We can to learn about the technique and everything. But when I go to Brazil in the moment, Dr. Vanderlim is going to give you 1 more patient. One more patient for you and 1 more patient for me. Wow, now I have 2 patients, 1 patient Thursday and 1 patient Friday. Another doctors, only 1 patient. Just Dr. Alonso and me, 2 patients. But it's a surprise. It's a very big surprise.
That was still the second day, I think. The first day he was explaining you how is the procedure about the zygomatics and the transnasal implants, the bomber, and a couple more.
Yeah.
And the second day he told, now it's time to show all the patients, show how looks all the bones, the maxillar of the patients and everything, and we're gonna decide who we're gonna perform these treatments. So he gives some the treatments of all the doctors.
The CT is a CT scan.
Yeah, the CT scan
And a paper.
Yes, and then the paper, basically the panoramic pictures.
Picture, yeah.
And then it was the next, and then he told I think one of the doctors is doesn't have any patient, but come here because we have another one for you. And that was me. So we were very excited.
Excited, yeah.
Because we perform all the kind of treatments.
Yeah.
So both of you were able to do zygomatics.
Yes.
How many zygomatics did you do?
4.
How many zygomatics did you do?
4.
So you guys both did 4 zygomatic implants.
Yes.
Right.
Right.
So you didn't think you were going to do zygomatics at all.
Yeah.
You said, I'm going to perfect the pterygoids, which you got to do, but then you also placed zygomatics.
Yeah.
So in algodones, just to take a precision of everything that we're talking about, not even 1% of the dentists in the world do zygomatic implants in the United States. So in Mexico, here in algodones, they say that there's over 1,500 dentists. Perhaps there's a lot more. And out of those dentists, so far there was a total of 3 that did zygomatics. And we had 1, which is Dr. Elias.
Mm-hmm.
Oh, yes.
And now there's 5, and we have 3.
Right.
Right.
3 dentists that do zygomatic implants. How do you guys feel being able to do zygomatics and
Really
learning from
excited.
Dr. Vanderlim, which is huge?
Really, really excited.
Really excited. Yeah.
That was one of the most beautiful and happy moments
Wow.
I think in my life.
He changed, Dr. Vanderlim changed my mentality. Now I have how I can
You have a better vision?
a better vision about the bone, about the options, because before the residence, my vision is good. We can put 4 implants here, but I don't have bone. We can use small implants, or we can change the position. But now, after the residence, my vision is different. We can see another option, for example, the transnasal bone, the zygomatic bone, the different options to help my patients. It's a very, very good experience, for sure. Now my mentality is it's better.
It's more clean.
It's more
right?
clean. Now it's more clean and clear.
So
Sure.
can we say that if a patient comes in there is no reason why a patient cannot have something permanent.
Right.
Right.
That is correct.
So you guys have, before you guys went to this residency, you guys were able, both of you guys were doing pterygoid implants.
Yes.
With the pterygoid, the palatal approach, the transnasal, the nasal, the Patsy protocol. You guys were doing all those things, and you guys were giving everybody a chance. But there was those ones that needed zygomatic,
Yes.
Yeah.
and it stopped there. Then Elias went to training
Yes.
in Brazil
Yes.
with Dr. Juan Gonzalez. And he came back to be able to do zygomatics. We ordered zygomatics. Everything was ready to go. But now you guys go to this residency. Now you guys can do zygomatics. But you guys came back talking also about there was a bone back here. Can you tell me a little bit about that bone and how Dr. Vanderlim was able to do that? Because that's patented, right?
Yes.
That's okay.
Yeah, he is the creator of the technique.
Talk to me
He
about
has the patent. Yes, for sure.
Talk to me.
You remember yeah?
Yeah.
Go.
He explained about how he find this part of the bone. He have more than 30 years, I think,
Maybe.
placing these kind of implants. I mean,
Yeah.
the zygomatic implants, and also we have to lift completely all the gum, and we have to see all the structures around to find the better bone, the better quality of the bone. So he explained about doing this kind of treatments for several times. He saw a part of bone here, very, very strong bone, because we have to sometimes lift the sinus. I mean the sinus, the nostril here, the floor nostril,
Nasal flooring?
the nostril floor. So he did all the time that procedure. He lift this part of the bone. So he was looking this part of the bone all the time with all the patients, but there is no research or books
books or papers with that
that information.
That information.
So he started to read about the anatomy in this area and see that this is a very, very good bone, very strong bone, and good quality of bone. And he is trying to put longer implants in that area, but in a how can I say in like a hands-on, but
Okay.
And he's printing the models, a plastic
printed models.
The
Yes,
printed models,
for
okay.
real
Well, real patients.
real patients,
Real patients models, okay?
models.
Yes.
Yes, for sure. And one time he put the transnasal implant,
Yes.
just to check everything,
just to see how it was
Just-
by the time.
Yes, and the follow-up is 5 years or 6 years later.
Yeah.
Everything perfect.
Everything perfect, everything very good. He tried again with another patients. Everything goes
Everything
perfect in 4
perfect.
months. The talk really good. So he started to practice perform this technique, and now he is the creator of this
creator.
technique.
What is the technique called? Do you know?
This is a transnasal implants,
Transnasal.
but it's attached in the concha nasal.
Concha
It's
nasal.
right
Conch-
here.
the conch nasal.
Concha nasal.
The nasal conch.
Yes.
It's a very wide bone, but it's very specific area here.
Yeah.
It's very, very.
And
Very,
that
very
is-
specific.
So that's the Vanderlim nasal,
yes.
Yeah.
nasal.
Well, it's transnasal Vanderlim technique.
Vanderlim
Transnasal Vanderlim technique.
Yes.
Yeah.
Wow. You know, when you guys came back, you just performed that technique on a patient.
Right.
And you were so excited. He ran over there from the other clinic. Dr. Lees, he's like, what is Dr. Alonso doing? He's doing, they had just came back. They hadn't told me anything about that. And I told them, hey, yeah, he's talking to something about a transnasal conch or nasal conch or whatever, that thing that we're talking about here. And you're like, come on, let's go.
Oh yeah.
And we went to the surgery room, and you guys were like kids in a playground. But
Yeah.
what does that do for our patients?
This is because sometimes right here in this front area, and there is no bone, or very the quality is too bad. So always this part of the bone in the nostril always is there, always is very strong. So now we can attach those implants when the patient doesn't have any bone in this front area. And another thing very important is Dr. Vanderlim said he wants to avoid always the
quadsigoma.
the quadsigoma. So he tried to avoid always the quadsigoma because it's more difficult,
more complicated. Yes.
more complicated. They have more results, more complicated,
More invasive.
more invasive. Yes. So the main purpose to place implants right there is avoid the
Having two zygomatics on each side, a quadsigoma.
Yeah.
the quadsigomas.
Why? Because with the all-on 4, we need 2 implants on the front area. Zone A. We have 4 different zones: zone A, B, C, and D. Okay. The basic all-on 4 is zone A and zone B. Sometimes we can try with zone C, but it's very important when we have a patient with atrophic bone on the zone A. A regular implant is impossible, but we need to offer a solution. What is the solution? A transnasal implant or quadsigoma. But the quadsigoma sometimes is very, very hard. Sometimes it's very difficult or is impossible.
Sometimes it's impossible.
Sometimes it's impossible.
For our patients, right now when you talked about A, B, C, and D,
Yes.
we'll go ahead and put a picture here talking about that, and also about the transnasal Vanderlim technique.
Right.
Where so you guys could see everything that we're saying. It's correct. But so this is what this means. This means when the patient comes in, pre-visit, they come in, they talk to our amazing agents, then they come here, and we're able to help them out. Like, they're gonna get something permanent, hopefully right away. But if not, at some point, they're gonna get something permanent. It could be 4 months later, 6 months later, but 95% of the time is going to be right then and there, or maybe even a higher percentage. Nobody else offers that here. They don't.
Yep.
Now with the technology, now with everything that we have, and now we have a post care. So for example, we want to introduce supremedental concierge. Gabby is part of our concierge team. And while you're waiting in the lobby, she'll be able to speak to you, make sure that you know exactly how your loved ones are doing. Make sure she offers you different, you're in a different country. You don't know what to eat a lot of the times. You don't want to walk around. Somebody that's there to help you out. She has the menu. She has, everything from juices to food, everything to fully take care of your supreme dental experience. That's something that we offer that nobody else offers here. On top of that, we have our surgical wrap that helps compression, that helps, keep the coolness the first 72 hours, and then the heat. So we're doing all those things. Part of we also have the Eternal Beauty, which now you can get the lead therapy, which is the only one that's approved by the NASA.
Yeah.
That it's a proven fact that if you use it before surgery and after surgery, it brings down 35% of inflammation.
Yes, for sure.
And we're also offering IV therapy, which means when you fly in from Florida to New York, you come in already dehydrated. Then you want to put under sedation to get this work done. 20 extractions, 8 implants, whatever it is. Your body's trying to help you out and get better. But what better than having it ready to go, hydrated with the vitamins that you need? Because most of the time you really don't want to eat much.
Yes.
So you're going to walk out looking better and feeling better than when you came in.
Yes.
And that's what we're doing here at Supreme Dental. So we don't just care about bringing you in. We care about the experience from the moment you leave your home to the moment you leave back to afterwards. You'll get a call. How is everything going by Lucelli, one of our agents? So that's what we're doing here. So you guys make sure that we're able to make their smile happen. We make sure that we have their full dental journey, that we make that happen.
Yes.
So we want to give a shout out to Gabby and Concierge. Welcome to the team. She's no longer in reception. And also to Eternal Beauty with all these new packages that we're putting out. So while you're in the lobby, somebody's going to take care of you. And while you're waiting, why not look better and feel better with Eternal Beauty? Yes. But so let's go back to Dr. Vanderlim. So I was super excited because to me, you guys are dental nerds. Okay. I'm sorry. Okay. And you guys do a lot of I say dental. Okay? You guys watch videos and you're, oh my God, look at this. And come here, Frank, come here, look at this. And I'm looking at it. It looks like gums to me, but to you guys, it's, no. But look right here.
Right.
You see this bone right here? Here's the conch.
Yeah.
The nasal conch. And you see here, and it's 20 milli.
It's the zygomatic bone.
And this is the zygomatic bone. And I'm like, I just listen to you guys, and I'm just like, oh, yeah, man, it looks great. I don't know what I'm looking at.
It's
But
hard
hey,
pictures.
But hey, my wife still can't look at those pictures. She's just like, oh, no. And to me, it's like, I could be eating spaghetti and looking at it. To me, it's normal now.
Normal
you know
for
what I'm
you.
saying?
Right.
Normal for you.
I look at it and I'm like, you know what I'm saying? Keep
Yeah.
on going. But
Yeah.
it becomes normal. To you guys, it's normal. To you guys, it's passion because this is what you
Passion.
love to do.
Yes.
Yeah.
And that makes me excited. But while you guys were in Brazil, I heard that Dr. Luis had some experiences. So, Dr.
The
Luis,
beach or where?
Crazy experience.
and so Luis is he's an awesome dentist, but he is a character, and he is all into building things, we could say. So tell us a little bit about what happened with at the beach with so you don't get burned, because as we could see, amazing tan. And Dr. Luis is not tan.
Not 10.
And they were both at the beach. So can you tell me what's going on? Did you use some anti-tan lotion or what's going on?
Is that the last Saturday? Yeah.
That was I think the last.
Yeah, the last
Saturday.
Saturday, I think so. Yeah, but it's a very, very hot day. Very, very hot day. The sun just here. And I can feel very, very hot, the temperature. And Dr. Alonso is very, very happy, but I am not happy. I feel hot. We need to do any, like, shadow for my body. Shake for sure. And, okay, we need to find a couple, what's the name?
Sticks?
Pillars.
Some pillars.
Stakes.
Sticks.
And we can do like a building with my
Sure.
that toalla,
The towel.
the towel, and okay, everything good. And I put my body inside. And Dr. Alonso, what happened? What happened? Remember?
Yeah, I was looking, Dr. Luis, thinking about. I don't know. Just he was doing something over there, like 30 meters of me, and I was. But you take around like 20 or 30 minutes, and I was taking the sun and looking the beach, and you know,
Relax.
just relaxing, relax, yeah. And but he very, very focused doing something over there in the.
He said he had different sticks. He was breaking sticks.
Yes, breaking sticks, and then put something right there to protect
Yeah,
of
to
the
protect.
sun.
So then he built a frame. Made of sticks.
Yes.
And then he put his towel over it.
Yes.
To create some sort of shading ramada.
Yes.
And we'll post a picture up.
Yes. And 30 more minutes after the building, Dr. Alonso and me, we are going to like a rocks.
Some rocks.
It's a rocks, but it's a little more long distance. And Dr. Alonso, he looked at me. Doc, what happened, Luis? Because my face looks with
Full of sand. It was full of sand.
Yeah, what happened? No worry, everything good. You can see in a moment what happened. And maybe for 1 hour more, when Dr. Alonso and me, we are back
yeah.
to the
To your
building.
ramada. To your ramada.
Dr. Alonso, can you see inside? And we can show you the picture.
So you put your face on the sand.
Yes.
But you picked up the sand a little bit. And you put two little sticks.
Yeah.
Which was your face with zygomatics.
Like a
made out of
zygomatics.
sticks.
And Dr. Alonso, where is the transnasal? Oh, let me 1 second. I put
And then we'll post another picture of it with transnasal.
Yes.
So if you guys ever think, what do these guys do when they go across the world? They build ramadas and they put their face on the sand while Doctor over here is enjoying the sand of the sun. He is, if you guys are ever, what is that movie called where that guy who has that ball, he's like, Wilson.
Oh, yes.
What is that movie called? It's that movie that
Wilson.
the guy is like lost in the water.
Yeah.
In this
the
island.
Tom Hanks. With Tom Hanks.
Tom Hanks, yeah.
And Wilson.
Náufrago is in Spanish.
Náufrago in Spanish.
I don't know what it's called in English, but it's the one with Tom Hanks, and he's like Wilson, and the volleyball has a face on it. That would be Dr. Luis. So you built your own ramada to keep you from the sun. You put your face in the sand to put zygomatics, and then transnasal, right?
Transnasal, yeah.
And then I've also heard that you built a zygomatic implant.
That was another day.
It's in
That
another
was
day.
another
Yes,
day.
yes.
The same thing. Spend a lot of time doing something
In the sand?
sun.
Yeah, but it's a
Like,
very
what are you doing, Luis? What are you doing? Just come here and take a look.
Just come here and take a look. Yes.
Big Sigmatic right here.
We'll post the picture on also. I don't know. How long do you think he took?
You take like around like a 30 minutes, probably.
Maybe 30 minutes. 30
minutes.
30
And
minutes.
he made an implant, a zygomatic implant made out of sand, and then you also put the zygomatic bone
Yeah.
and the
And my
implant going through a
zygomatic
bone.
Yeah.
Wow.
Very fun.
So,
Very fun
guys,
day.
I don't know where else you guys are gonna get this. Not only is they're doing it in training, but he's doing it in the sand. Like it's you can tell when it's someone's passion, because this is what you guys talk about. You guys were super excited when you guys were gonna go to Dr. Vanderlim. You didn't care it was in Brazil. It could have been anywhere else, but you were excited to be there with him.
Yeah. Yeah.
You guys came back and you guys told me you both did 4 zygomatics. You guys were super excited about that. Now tell me, we'll post some pictures up. In every picture, you guys are like this.
Yeah.
Because if you see the X-ray with transnasal, the transnasal looks like
a V.
like a V. Dr.
Dr.
Vanderlim
Vanderlim with the V.
with the V. Yeah, that's why this is the word.
So you guys, this is like when you guys took the picture, you
Yeah.
guys were saying like you guys
Vanderlim and transnasal.
Vanderlim and transnasal.
Transnasal, yes, for sure.
Wow.
Yeah.
The sun one.
I thought you guys were gangster. You guys were.
Yeah, but he say right.
Yeah,
Because we like like this or this.
No.
No, like that.
Like that, yes, for sure. But well, you remember the last surgery?
Like
you
doctor,
and me?
like patient.
Yes, the last surgery was very excited for us.
Very excited.
Talk to me about that surgery before we leave, because you guys were all about that surgery.
The
so.
first surgery is perfect, very good. It's 2 zygomatic implant, 2 pterygoid implant, and what?
Transnasals.
And 2 transnasal implants.
Transnasals.
And yes, but the last patient is very interesting patient. Why? Because we have the opportunity to put all techniques. Well,
Explore all techniques.
all techniques.
He said, Dr. Vanderlim
Yeah.
say, once did the extractions in bone regularization and everything, and then he take a look and he say, we can do whatever you want. I mean,
whatever you want, yeah.
what do you want to do? You can do, for example, the zygomatic implants here. You can do the transnasal, the pterygoid, but also
The bomber.
You can do the bomber. But also
What's
you
a
can
bomber?
do
The bomber is a bone here on the middle of the nose.
very,
Okay.
very strong
But
bone.
it's a very strong bone. It's a good option when we have here maybe 5 millimeters, 6
Yeah.
millimeter. It's another option, okay, to avoid the transnasal.
Yeah, it's not necessary to place longer
long
implants
implant.
here, but probably with 10 millimeters, 12 millimeters here in the front area because
Yeah.
it's a strong
It's a
bone.
strong bone. But depend of the scenario.
Yeah.
Okay,
This is
Scenarios.
different scenario.
different scenario. Yeah,
Yeah.
for sure.
And also, he say, or we can try with the transsinus implant also.
Yes.
Because in the last patients, the other patients with the other dogs, they doesn't perform any transsinus or any bomber implant. And he say we can do all these techniques
All
in
this,
just one
yes.
patient, and just we
Well,
say
go.
let's go, let's
Let's
do
go.
this.
So both of you guys said we can do it.
It's a pterygoid implant, sinus implant, bomber implant, transnasal implant,
The
and zygomatic implant, and it's a palatal approach.
And yeah.
and one palatal approach. Different techniques,
So-
only one maxilla.
So both of you guys were with Dr. Vanderlim in the last surgery.
That was the last surgery.
He looks very
Friday
very
in
happy.
the afternoon.
It was the last one of the course,
Yes, the last one of the course.
and both of you and Dr. Vanderlim were there. And you guys were able to perform everything.
Yes.
He was very excited also.
He
Dr.
very
Vanderlim,
excited.
Wow.
Wow.
Yeah, we can do here.
Take a picture, take
we
a
can
picture.
play with all the procedures.
Yeah.
And the rest of the doctors looking because
Yeah.
was the first transnasal and the first bomber implant.
Yes.
So he was learning all together.
Yes, all together. We take a couple pictures of the surgery.
Yeah.
Probably is the next picture of the next book of Dr. Vanderlim.
Probably.
I don't know.
Wow.
Probably.
He was very excited. Hey, this looks like a picture of books. I want to take some pictures. And then
Wow.
One guy from Poland.
Poland.
He looks excited. He's a very, very serious man. All course, all resident, very serious. But in the surgery,
Smart
wow,
man.
it's
Very
a
smart man.
very good surgery. Yeah, very smart. Yes.
I think that was the second time with Vanderlim.
Yes.
All the doctors, they have a lot of experience. A lot. We can see just lifting the
Old men,
the gum and
Older
positions.
dentists.
All
older
the dentists have a lot of experience. We was the younger.
Yeah.
Younger.
Yes,
You guys
for
were
sure.
the youngest, and you guys were the only ones from Mexico.
Yes.
I'm from Mexico.
From
Yeah.
Mexico.
Remember the first day? Wow. Looks very hard, everything.
Yeah.
Are you ready, Alonso? Well, I am ready.
Yeah, all the doctors like 35 years old, 40 years,
40 years, 55
old,
years.
with a lot of experience, 20 years doing these treatments, and just
A couple T-shirts.
yeah, they
How
are
old are you?
teachers. 31.
How old are
I'm
you?
33.
So 20 years ago, you were 13 and you were 11.
Mm-hmm.
Yes.
So those guys have been doing that when you guys were not even barely teenagers. You were a teenager. You were, yeah.
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 How does that make you guys feel that you guys are around dentists that have been that are a lot older than you guys, but you guys are
On the
operating right there with Dr. Vanderlim, and Dr. Vanderlim is saying that this is good enough to put on the next book.
Yeah.
Yes.
You know what? One thing is at 31 years old and to perform this kind of treatment, like perform regular treatments. But another thing is perform a very complicated surgeries with 31 years old. And I think Dr. Vanderlin is something that he can
Respect.
he respect with us, and that was very, very grateful for us.
And Dr. Vanderly, he told me, go ahead with the stitches. No, stop. You first, please. Show me.
Yeah.
It's just the stitches. Looks very
And
easy.
he said like,
The-
you sure you?
all group perform the stitches.
The whole group, yeah.
Yeah, but no. Let me see your technique.
You asked him to do the stitching, his
Yes, for
technique.
sure. I am here to learn about
It
of
was
you.
very exciting. Just
Yeah.
seeing.
We can see
how we can-
a lot of different tips. Tips is correct.
Yeah,
correct.
tips.
Yeah.
Yeah.
Tips. Wow. he put the stitches with another technique that looks amazing. I can to learn very, very different techniques with the stitches. It's just the stitches, but very interesting.
Would you guys? His stitching were amazing. You told me it was like a net. That how he stitched everything in that patient's mouth, and that everybody started clapping afterwards, because everything was performed on this patient. It was you, both of you, and Dr. Vanderlim.
Yes.
Would you guys go to another Vanderlim residency? Would you guys want to go to another training from Dr. Vanderlim?
When?
Would you guys like to go to another one?
For sure.
100%. Yeah.
100%.
Yeah.
Yes.
Of course.
100%.
Of
It's
course.
because with Dr. Vanderlin, we have the opportunity to take the training with patients, real patients. Sometimes it's with cadaver or models, but in Brazil, it's with real patients. It's a little more hard. It's a better experience.
You guys get to learn a lot more.
Yes.
Well, look, I don't know if you guys can feel this at home, but these guys are super excited, and you could feel the excitement when they're talking about this experience, and them being 31 and being 33, and having this excitement, and having this level of expertise and this level of talent you will not find anywhere else. When do you ever hear dentists talking about this exciting about doing so many different types of procedures? You know, it doesn't happen that people fly across the world to get this type of trainings just to get better for you guys, just to be able to offer you guys the better, something that's going to last, to protect your investment and to give you that smile that you deserve. So thank you so much, guys, for being here today. It's a privilege. It's an honor
Thank
to
you.
work with you guys.
Thank you.
Super proud of you guys. And I don't know what to say, George. You look great over there, by the way.
You look nice.
Looking good.
Yeah.
Looking good. Yeah, there you go. Thank you so much for being here at Supreme Dental Podcast Studio. I mean, guys, what do I say? It's you guys were super excited. I'm super excited.
Yeah.
I mean, there's no roof to what you guys can keep on learning. And keep on smiling. But before we leave, we got to do the Vanderlim V, Dr. Vanderlim shout out, and we're gonna get you over here in Mexico, I promise. But have a good one. And this has been Supreme Dental Podcast Studio, powered by Supreme Dental. And just like these amazing guys, keep on smiling.
Thank you.
Thank you.
And if you don't know, now you know, you know, you know.
That's right. East Coast.
And if you don't know, now you know, you know.